And welcome back. I'm Mabel Jong. You're watching Day 2 coverage of the World Healthcare Congress here in Washington, D.C. Thank you so much for tuning in. I'm here now in our studio with Dr. Martin Kistin, who is with Project ECHO, and I'm going to find out exactly what that is. Hi, Dr. Kistin. How are you?
Just fine. Thanks for having me.
Well, tell me what Project ECHO is.
So Project ECHO was conceived and developed in 2004 by one of my partners to try to solve the problem of untreated hepatitis C in New Mexico. And we use video conferencing technology to train providers to take care of patients for complex chronic conditions that they otherwise would have to refer them to a specialist.
Okay, very interesting. You said untreated hepatitis C. Are there many people walking around with untreated hepatitis C?
So untreated hepatitis C, certainly in those days and even today, is a huge problem in New Mexico and around the world. The disease itself is very severe and untreated, can cause cirrhosis and liver failure and even death if you don't get a transplant. The good news is that if you can have your infection eradicated, that 90% of those complications go away. The problem was in those days that the treatment was very toxic and hard to administer, and most providers didn't feel comfortable doing it. So that the only place you could get treatment in those days was at the academic medical center at the University of New Mexico Hepatitis Clinic, and there was a 10-month wait to be seen in that clinic. And even if you got seen and started on treatment, you had to come back once a month for 18 months, and many of our patients had to drive 250 miles each way to be seen in the clinic.
How is it contracted?
So it can be contracted in numerous ways. In the old days, before we knew about hepatitis C, you could get it from blood transfusions. More common routes these days would be tattoos, risky behavior, drug use, type of thing.
Okay. Now you mentioned the use of technology as a tool to treat this. Tell me more about that.
So what we decided to do, since it was obvious that we weren't moving the patients to the knowledge and expertise they needed, was to try to take that knowledge and expertise and move it out to where the patients were. So we set up virtual clinics once a week, and providers in these rural underserved areas would log into the clinics with a specialist, and they would present their cases of hepatitis C, and the specialist would help them manage those cases. And there might be 10 or 15 providers online with the specialist every week. And so each provider might present 1 or 2 cases, but they'd be able to hear and participate in the presentation of 10 or 15 cases, so that over the course of a year, they would see 600 cases managed, and hopefully then would feel comfortable treating their own patients for hepatitis C, eventually feel comfortable being a consultant to their partners in their own clinics, and eventually the hope would be that they would be able to be a consultant for their geographic region and amplify that expertise of the specialist to that underserved area.
Is hepatitis C, are the numbers unusually higher in New Mexico than in other states, or is it because you have a good support system through Project ECHO to address
So
these cases?
I would say that we had probably higher than our share of hepatitis C, including these rural outlying areas and the prison system, which we also have made efforts to treat. I would say worldwide there are areas where hepatitis C is much more of a problem, but I think every place now has a problem. And when you look at it, if you look at cancer in this country, for instance, all cancers are decreasing, except for liver cancer. And the reason liver cancer is not decreasing is because if you have chronic hepatitis C and it doesn't get treated, you eventually may get liver cancer. And most people feel that that's responsible for the increase in liver cancer in this country when all other cancers are decreasing.
Dr. Kistin, what other parts of your message would you like to leave with attendees?
So this is a project which we have shown can deliver as good or better care using this method as if you were to have access to an academic medical center specialty clinic. It's now been rolled out across the world in 50 different conditions other than hepatitis C. We have partners with 45 academic medical centers around the country and with 12 or 15 countries around the world. as well as partnerships with the American Academy of Pediatrics, the Centers for Disease Control, and the Indian Health Service, and huge partnerships with the Department of Defense, the Air Force, Navy, and Army, and with the entire VA medical system. Our goal at this point is to touch the lives of 1 billion people using this model by 2025.
Wow, impressive numbers, really impressive. Thank you, Dr. Kistin.
Thank you.
Thank you for your time. And I'm Mabel Jong. Thanks for watching. More interviews to come.